Rhiannon Mascarelli, May 4th, 2026. This is my note page. Doing my final presentation project, and the topic I chose was urinary tract infection. By definition, this is an infection of any part of the urinary system, being the kidneys, bladder, or urethra. It can be classified in a few different ways. It can be classified as infectious, which is caused by bacteria, and that's the most common cause. Location is upper or lower, so upper being kidneys, lower being bladder or urethra. Complexity, so it can be complicated, which is anything that makes it more difficult to treat or more dangerous for the patient. Or it can be uncomplicated, which is typically a healthy female with normal anatomy, and the reason why it's female is because it's less common in males, so that would make it complicated. Another is by duration, so it can be acute, which is a rapid onset with short duration, or chronic, which is more prolonged onset and typically lasts longer. It can be months to years. Etiology, most cases it is bacterial. The most common bacteria that causes it is E. coli. Some other potential pathogens would include Staphylococcus saprophyticus, Klebsiella, Proteus, or Enterococcus. The type of syndrome that it falls into, although not typically classified as an actual syndrome, it is sometimes loosely considered a urinary infection syndrome, or LUTS, which is lower urinary tract symptoms. So it's all things that group it together, which would cause it to be considered a syndrome. Clinical manifestations, patients would typically present with complaints of urinary urgency, meaning that they have to, when they get the urge, they feel like they need to go immediately. Urinary frequency, so they're going more often. Dysuria, or pain with urination, commonly described as pressure or burning. Pain in the lower abdomen or suprapubic area. Flank pain or costovertebral angle, which is where the kidneys sit in the back, would be indicative of more of a kidney location. Cloudy, foul-smelling urine, and also in more severe cases, the patient may present with a fever. Most important diagnostic test and the gold standard is urinalysis dipstick and then micro. So on the dipstick, you would find leukocyte esterase, which is an enzyme released by white blood cells and indicates infection, or nitrates. So many bacteria, especially gram-negative ones like E. coli, convert to nitrates or nitrites. And then you would also see blood on the dipstick. On the microscope or microscopic test of the urine, you would see RBCs, or red blood cells, which indicates hematuria or blood in the urine, white blood cells or leukocytes, which indicates infection, and then bacteria, which also indicates infection. And then you would typically follow this with a urine culture. So with the culture, it takes a little bit longer to come back because you have to allow time for the culture to actually grow, but it would indicate what the specific organism or bacteria is that is causing the infection and help identify proper treatment or antibiotic sensitivity of the specific bacteria. Differential diagnosis, a lot of times it could be a STI, such as chlamydia, gonorrhea, or trichomoniasis. These particular STIs mimic UTI because the main symptom is dysuria. So typically they lack bacteria on urinalysis, and specific testing for STIs is required for diagnosis. One test that you could do is a nucleic acid amplification test, or NAAT, which is collected via urine sample, which is the most common way to obtain a specimen for that specific test. But also you could also get a vaginal or cervical swab during a pelvic exam, or a urethral swab for a male to test for chlamydia or gonorrhea. And then to test for trichomoniasis, you would look for the flagella bacteria on a wet prep slide under a microscope. Possible complications that can come from UTI. So the bacteria typically enters the urinary tract through the urethra. And one reason why it's more common in females is because anatomically a female has a shorter urethra. So it's less ground for the bacteria to cover, and less likely that it would be destroyed prior to actually causing an infection. And the urethra travels upwards to the bladder. So if the infection goes untreated or if it's severe, it can result in pyelonephritis. This is an infection of the kidneys, so it is technically still a urinary tract infection, but it is much more severe and it typically requires a longer course of antibiotics. It's a lot more painful and patients become febrile, and it's they're actually ill when they have pyelonephritis versus just experiencing like discomfort when you have a UTI or urethra or bladder infection. Another complication that can also result if, pyelonephritis continues on and goes untreated is urosepsis. And this is when the infection enters the bloodstream and becomes life-threatening. Additionally, the infection can lead to acute kidney injury or chronic damage or scarring of the kidneys, which can be permanent. And then also, if pregnant or UTI with pregnancy, it can increase the risk of preterm birth or low birth rate or birth weight.